Welcome back to the Morning Blend with our continuing series, Today's Senior with Synergy HomeCare. Most seniors want to stay in their own home, and it's not hard to understand why, but getting older can present challenges with mobility and the ability to stay safe.
Joining us now with some ideas to keep you safe and out of the hospital are Ruth Busalacchi from Synergy. Give a little wave. There you go. We've got Armando Suarez del Real. He's the captain with the city of West Allis. Then we have Daniel Weber, Battalion Chief with the city of Greenfield, and Maggie Sutton, a social worker with the city of Greenfield as well. Welcome to the show, everyone.
Thank you. We got a whole couch full.
Thanks
I
for
like
being
that.
here. So let's talk about this a little bit, about some of the programs in the communities that you guys have to keep people safe.
Yeah.
So what we have is at the City of West Allis Fire Department, we have a mobile integrated healthcare team. It's a proactive approach at looking at EMS. What we're doing is we're finding our high utilizers, the people that are calling 911 often, the population that's at risk, that has correctable issues where we can align them with services available, and do one-on-one home visits with them, kind of reimagining EMS as it is right now. Instead of being reactive where you call 911 and we come, now we're seeking you out based on risk factors and social determinants of health, and trying to help you stay in your home as long as you can, be as safe as you can.
I love that proactive approach, and it seems so caring in our community rather than, and responding is important too, which you do every day, many times a day. But I love this idea of kind of greeting people where they're at, and it seems like it's multifaceted. So you've got the EMS, you've got paramedic teams, but it's also social services. It's a lot of agencies sort of working together to help people who want to stay in their homes but also stay safe.
It's truly a collaboration. We've invited our health department to help us as well as the Department on Aging in the county. So we're all working together to try to be proactive and prevent 911 emergencies from happening in the first place.
Yeah.
So I think that would be helpful because, if somebody's home or living home alone, sometimes there's a lot of fear about that as well. How does social work play into that? Because you're working as a social worker with the department.
Absolutely. I have the opportunity to follow up on those 911 calls and reach out to individuals' family members, bring a team together, and then bridge the gap between their needs and the services that are available within the community.
What about success stories that the two of you have seen in your own communities about services being intended to taking care of people and then sort of reducing those unnecessary ER calls?
Well, not everything that we have is a big dramatic call. On this side of the fence, we're not talking about these giant saves. We had a patient last year that was falling, and they were calling us about 5 times a year. And on the surface, that doesn't seem like the big of a deal. But once we had that home visit with them, we tried to figure out what's going on. It turns out that every time, or not every time, but most times they'd get off the toilet, they would fall. And they'd have to call 911 and we'd have to come in. Well, something as simple as putting a grab bar in their bathroom. Now they're not calling 911 anymore. And we're reducing their ability to need to have to call 911 and keeping them safer at home as long as they can.
Similar story where we had an elderly couple that was, the husband was falling, and we were able to hook them up with resources through Synergy HomeCare. Synergy came out, did that home assessment, and was able to find them an additional pension through the through the VA to pay for home services so that they could stay in their home longer.
Wow, and that's what everybody wants. We want our parents, and our parents want to stay at home. For you, Ruth, how are you seeing working with West Allis and Greenfield kind of helping you? Because even like the grab bars, and I know you do assessments on rugs that are slipping, or because a fall can be detrimental if you break a hip or break a bone or can't get up.
It's a great working relationship because families trust their local fire and paramedics and a social worker. They trust them. So when these folks can give us a warm introduction and say we have a solution, maybe they didn't know about that solution, that we could bring in a little bit of help, and maybe they didn't know that there might even be funding to support and pay for the care. It's just a win-win. So whenever we get the call from these folks, we really try very hard. We do everything we can to make it successful and make them feel comfortable.
What strikes me, and probably you too, Ruth, is that both the captain as well as the battalion chief are talking sometimes about fairly simple solutions that make people exponentially safer in their own homes.
So many people think I have to keep my issues to myself, because if anyone finds out, I'm going to end up in a nursing home.
Right.
That's just a strong held fear. And when they learned through these folks and then through us, through Synergy, that it could be something very simple and it could be less expensive and you don't have to move, that's, you know, how can you not be accepting of that information?
Well, and it's not only that you do, but you also help with doctor's appointments and grocery shopping and meal prep, things that, like, I think about even, you know, my mom trying to carry groceries in the house.
Right.
Different things like that, that it would just be so helpful to have someone there that you trust to intervene and help.
It can be a snowball sort of an event where you're too weak to go to the store, so then you don't eat well and you don't get your medication. And whereas our caregivers can come in and they can take you to the store or do some shopping for you, they can get your medication for you, take you to your doctor appointments. It's very, as you said, it's a very simple fix sometimes.
Thank you to all of you for the collaborative approach that you have to this, because we all love people who are older who want to stay in their home and they need the help sometimes to do it. So thank you so much. We want to share the contact information for your departments, because I think it's so great how you're leading the way. So first of all, the Greenfield Fire Department, there's a phone number there, as well as the West Allis Fire Department. If you missed those phone numbers, you can go to our Morning Blend website to check them out again and get in touch with them about the things that they're doing in their communities. To call Synergy Home Care, you can reach them at 414-763-8368. And you do so many great things with personal care, meal prep, grocery shopping we mentioned, medication services, housekeeping, all of these home care services. You can find out more about that by going to synergyhomecare.com. Wonderful
Even
to
helping
see
with
you all.
that veteran funding, all that stuff that you guys do. Thank you so much for all you do.
Appreciate it.
Yeah.
Thank you.